Hello, everyone. I'm Katherine McKernan, the Deputy Chair of Homelessness Australia. I'd like to acknowledge that everyone attending the conference is on different Aboriginal lands today, and I myself am on the Gadigal land of the Eora Nation. I would like to pay my respects to elders past, present, emerging, and acknowledge that this land was never ceded. I'd like to welcome everyone to the first plenary of the conference. Building Back Better, can the crisis become an opportunity to reduce homelessness? But first, we would like to thank the support of Mission Australia, who are platinum sponsors of the conference, and we now have a few words from their CEO, James Toomey.
Hello everyone. I'm very pleased that Mission Australia is the platinum sponsor for this Uhuru National Homelessness Conference. Mission Australia is committed to ending homelessness and ensuring that people and communities can thrive. Part of this commitment is to base our practice and our advocacy on evidence. For Mission Australia, that means evidence from the voices and experience of the people we serve, from our practitioners, from our research, and evidence from others, including the important research conducted through Uhuru. 2020 has been an extremely challenging year for people experiencing or at risk of homelessness. I'd like to acknowledge all of the people on the front line, especially those attending this conference, who've gone above and beyond in working with people in precarious and difficult circumstances this year. Finally, let me wish you all an enjoyable time at the conference, learning from others and working together towards a future Australia where everyone has a safe, stable home and the support they need to thrive.
Thank you, James, for that message. And now it gives me great pleasure to welcome Dr. Ligia Teixeira, CEO of the Centre for Homelessness Impacts based in the United Kingdom. Dr. Teixeira accepted our invitation pre the pandemic when it was to be a face-to-face conference in Canberra in the depth of winter in August. She may have escaped Canberra in winter and a 24-hour plus flight, but we are incredibly pleased that she could still join us virtually and open the plenary of the first plenary of the conference.
Thank you so much, Katherine. It's a privilege to be here. I'm really thrilled to have been asked to speak, and it's a shame I can't be there live with you, but nevertheless, a fantastic time to learn from each other. So thank you for inviting me, and congratulations on a very impressive conference, especially given the time we're living through just now. But who are we? Who's the Centre for Homelessness Impact? We're a new What Works Centre for Homelessness, set up to help address this question. How do we end homelessness for good? One of the most important challenges of our time if you're working in homelessness, certainly in the UK. And as you all know, homelessness is a very complex problem. Homelessness is systemic, it's stubborn. Too many people remain without a home despite significant investments in the field each year. Obviously, it's caused by a mix of factors, from financial stability, housing market dynamics, access to healthcare, and of course, to complicate things even more, there can be a mismatch between needs and the services on offer. The Centre launched in 2018 precisely because it was felt that a new independent organization was needed to act as a catalyst for evidence-led change in the field. So we can be confident that our values aren't only articulated in our efforts, but in our outcomes. Our mission is to improve the lives of those experiencing homelessness or at risk through evidence-led change. Now, I don't need to tell you how COVID-19 is making an already challenging situation far more difficult. So even before the pandemic, and I believe it was similar in Australia, demand was growing pre-pandemic. Spending on homelessness was rising, demand was rising. And though certainly in the UK, things like street homelessness was going down in certain parts of the country, what was very important to notice was the fact that the people who were new to the streets and they didn't have a history of street homelessness, those numbers were actually going up pre-pandemic. So really important piece of context. And something that we're very interested in is also those groups that are less visible. So of course, COVID-19 is having all sorts of impacts amongst the most vulnerable populations. But beyond the viral impact of the pandemic, there's many non-viral impacts, not just on people who are street homeless, but those less visible, certainly families and children. Something that it's really important to talk about at this time. So something we saw in the first phase of the pandemic was how governments across the UK at both local and national level really responded up to the pandemic at speed. It certainly made a difference. So over 30,000 individuals were moved to hotels from either the streets or other types of emergency accommodation. Also, a huge amount of measures were introduced to ensure that we were protected those most at risk. All sorts of efforts happened and they clearly had an impact. In fact, by June, only 16 deaths had been registered from COVID-19 across England and Wales. So that was a lot lower than the projection. So certainly lots to be proud of, but much work certainly remains as well. So what our work suggests to date is that the work that needs to happen, certainly in the space of evidence and data, that could be an important opportunity, is on 3 fronts in particular. So first of all, the establishment of better data foundations. At the moment, poor data quality is really weakening our ability to respond promptly to people's needs. Second, the creation of a more extensive body of evidence that enhances our understanding of what works. Certainly policymakers, practitioners, they actually need useful evidence, reliable evidence to make good decisions on. And at the moment, too little of that actually exists across the globe. And finally, the strengthening of the sector's capacity to act on robust evidence. So one thing is the evidence being there, a separate one is people being able to actually act on that in a timely basis as well. So taking each one of those challenges in turn, the fact that at the moment the data infrastructure is actually quite poor, and that's true in the UK, but also not fantastic in Australia from what I gather. And certainly COVID-19 really highlighted a number of things for us. There's certainly a new appreciation for data, but what there is often lacks the breadth and depth for the task at hand. In particular, given the dynamic nature of epidemics, it means that things shift so fast that we need to be much better at gathering and responding using real-time data. So it's one of the things that we really prioritize early on in the pandemic. And just to give you an example, we developed a tool that we came to call Housing Cost Calculator that was very much designed, co-created with partners in local areas with a view to helping them make better decisions when developing their move-on plans for people being moved from the streets. We found through our analysis internally that housing, say, 60,000 people, which is the number that they were able to house in the spring, for just 60 days cost roughly 45 million. And this excludes move-in and support costs. In contrast, if PRS, private rented sector accommodation, was used, that would only have cost 18 million for 2 months. So a huge opportunity to essentially adapt quickly, use data to develop move-on plans to both improve outcomes as well as save money. So that's just a little example. We're also working with the Office for National Statistics on a new set of homelessness indicators that we hope will be used widely across the UK. So with the Office for National Statistics and the Government Statistics Service, we're essentially developing indicators for our share framework. So what this gives you is essentially the ultimate vision that we're aiming for, any experience of homelessness being rare, brief and non-recurrent, but also helps identify the key areas that we need to focus on if we are, as a sector, to work towards preventing homelessness at population level. So it includes things like smart policy, housing system that leaves no one behind, all in it together, so making ending homelessness a shared priority across society, a focus on relationships, and finally creating an ecosystem of services that is very much person-centered. And the foundation of the framework is resources and leadership. There's always a limited amount of resources, so leadership plays a key role when it comes to making those resources go as far as possible. So together with the governments across the UK, we're developing a reporting platform that will not only bring together all the data that's relevant to preventing homelessness, but then start filling the gaps. At the moment, everyone, through an extensive consultation process, agreed that those 5 areas were the most relevant, but we don't have any data across at least 2 of those pillars you saw. So together, we're working towards filling those gaps, and over time we really feel that this will give us a really strong foundation to track progress across local areas and the different nations in the UK, so we understand whether we're really on track to preventing homelessness rather than just responding to crisis. The other gap in terms of data that we've identified is just better use of technology. So just to give you an example from international development, in Namibia, the government, when trying to prevent malaria, they'd been coming up with estimates based on 1.2 million for a number of years. And suddenly they started using satellite and mobile phone data to target efforts a lot better. And the transformation was visible. So suddenly they realized, by triangulating all the different bits of data, that actually they could narrow down that cohort to 80,000 people rather than over 1 million. So in homelessness, we do feel there's a lot to be learned from fields like international development, where technology has been put to good effect to address some important issues. And now moving on to the second strand of work that we should be focusing in if we are to accelerate progress in homelessness. So the fact that at the moment we often lack robust insight into what works. Now, we know from the evidence tools that we created when we launched the centre that rigorous evaluations of homelessness policy and programmes are still exceedingly rare. And this is the case in Australia as it is in the UK. And this is the case even though we know from other fields that better generation and use of evidence can unlock significant opportunities for improvements. So just to give you an example from education, here in the UK, our sister organisation in education, the Education Endowment Foundation, thanks to a trial they conducted some years ago, they realised that breakfast clubs are more cost effective than the government's flagship 1 billion universal infant free school meals policy. So without a trial, they would never have realised this. So it made a significant difference to government strategy. Another example, and this one is from Kenya, is Kenya's national deworming program, a randomized control trial that took place over a period of 5 years, made them realize not only how it was possible to scale deworming to across the country to lots and lots of children, 75,000 schools, the results were really, really impressive. But in addition to the health benefits, what the trial enabled them to see was that deworming can also reduce absenteeism by up to 25%. So something really surprising and encouraging that only an RCT could reveal. So really what we believe is that to achieve step-changing homelessness, we have to act with knowledge while questioning what we know. Why? Because many attempts to do good fail. So for instance, Scare Straight is a program that brings teenagers who are getting into trouble, into prisons, to show them the harsh realities of life behind bars. It's such an appealing idea that when it emerged in the United States back in the 70s, it really spread across the world. But the only problem is that Scare Straight style programs don't actually work. And in fact, they are pretty effective at increasing criminal behavior. So the kids who are actually exposed to such programs, and they still happen nowadays, are more likely to offend than not. So really important lesson. And what we know from systematic reviews across all areas of social policy is that as much as 80% of interventions that are used don't actually work, even interventions that seem like no-brainers. So all the more important to invest in this type of work. So again, we know all of this because of the evidence tools that we developed when we launched the center, and we since then started co-creating systematic reviews and trials with people with an interest, obviously, in the work from practice and policy at home and obviously internationally as well. The good news is that there is evidence out there to build on, and quite a few things appear to work. However, at the moment, most of the evidence comes from North America. We need more local studies. So there's a similar number of this effectiveness studies in Australia as well as in UK. About 11 in our latest map are from Australia. So a lot of scope to do more. What the tools also show you is that multi-component interventions, or holistic, as they are often also called, appear to be more effective, but we don't really understand why that is. And one of the things we also know is that even if lots of things that have been tested appear to work, we can't do everything. So we need to be able to prioritize, which is where experimentation can really help. So to just give you some examples of the types of trials that we've started setting in train to help address the gaps in our evidence and gap maps, we are, for instance, conducting the largest trial of its type in the UK to date that will essentially look at the relative effectiveness and cost effectiveness of settled accommodation in preventing COVID-19 infection, but also reducing housing instability for people who have been sleeping rough during or immediately prior to the pandemic. We are also looking to extend the study, not just to more parts of the UK. We're going to start in 6 cities, but the idea is to scale the study over time, including to other countries, because we feel that some of these trials should be happening internationally, because, say, London has more in common with cities like Sydney and Melbourne than anywhere else in the UK. So that's something that we're really looking to do. We're also investing in a number of studies that will challenge common assumptions. So for instance, direct cash transfers. They are a very simple intervention. They're all about giving more money to people, and they have very good evidence base in international development. So we're starting to see these types of interventions in homelessness. So for instance, a team in Canada introduced a small trial recently, and the results were very positive. So we're essentially working with a number of partners in the UK to do similar things here in the UK. Very simple interventions that really focus on giving money directly to people, challenging basic assumptions. And we're also trying to do all that we can to encourage people to act on the great evidence we already have. So, for instance, we know that most people need temporary low support with resolving a recent housing loss and other significant life event. Most people affected by homelessness do not necessarily need emergency housing. So by reallocating resources towards prevention, including interventions that help mainstream services respond more effectively to people at risk, and more normalized housing environments, our approach to address homelessness will not only be more humane and effective, but also potentially cheaper. That's what the evidence at least seems to suggest at the moment. Obviously, we also know that to stop the flow of new people coming into homelessness, we need to address the larger housing affordability issues and ensure welfare support and wages are adequate. It's because of that initiatives like the one relating to social housing and injection in social housing in Victoria seems so positive. And moving on to the final pillar of the strategy. The fact that, it's not sufficient to generate more data, generate better evidence. We also need to work alongside leaders across local areas, national governments, to help them make sense of that evidence and help them act on robust insight. One of the things we've seen during the pandemic in the UK that's really encouraging is that it really does seem to have activated a sense of urgency to help people who are street homeless or poorly housed. And we're even starting to see examples of local areas wanting to design out emergency accommodation locally. So really interesting developments. Now, we're also finding that those city leaders are more often than not committed to using data and evidence. But while the commitment is there, it's not always easy, and people really need support, in particular because we know that often evidence knowledge translation is very much to do with relationships. So given what we know, what we're hearing from people, as well as what we know from other fields like education, the fact that simply churning out reports, it's not sufficient, even if you have them in different types of formats. We are very supportive of capacity building initiatives. So something that we started last year is the What Works community. So we started very small, as we do with most things, in 3 local areas, and this year it's scaling to over 20. Precisely just to focus on what do local leaders need help with, and let's give them new skills, new techniques to make that happen. We always work in partnership. Our partners for this initiative are Johns Hopkins University in the States because of their expertise in data science, IDEO, who are a very well-known agency that focus on person-centered design, and finally the Behavioral Insights team because of their expertise in rigorous evaluation and behavioral science, because we do feel that behavioral science is a very promising area when it comes to what we're trying to achieve. But capacity building is also not enough. So something that it's really important for all of us to do, like what you're doing by bringing together this conference at this time, is really discuss all of these issues. And our latest book was published precisely to do that, to help instigate that cultural change that we feel needs to happen in the field. So it brings together a range of voices, all helping to make the case that this is the time to really try to aim higher, building on the great work that's been done to date. Because even if what we're doing is working, there may always be ways of doing something better. So the whole What Works approach is very much about adopting a very humble mindset, that it's very much about continually always trying to do better. And just to wrap up, a question that I'm often asked about, what is the most effective way to spend a marginal dollar? Now that's, I'd need another 30 minutes to talk about this one. So just very briefly, We know that this question matters because resources are always limited. A huge amount of money does go into helping to tackle homelessness, and it's impossible to tell at the moment how much is enough. So certainly in the UK, most of the money dedicated to homelessness as well goes into temporary accommodation. So not only that, it goes towards the most expensive type of accommodation, temporary accommodation that is often of poor quality. So what can be done about this? Well, one of the things that obviously needs to happen is to ensure that systems are paying greater attention to prevention, in addition to any experiments we may want to conduct. So this is a photo from Salt Lake City. It's a good cautionary tale why back in the early 2000s they invested hugely in housing first, and over a period of 10 years chronic homelessness went down by over 90%. So understandably that news story made it across the world, fantastic news. But what the headlines hid was a much more complex truth, that while chronic homelessness went down radically, other types of homelessness in Salt Lake City continued to grow. So a really good cautionary tale that, you know, even things like housing first, there's no silver bullets, can be a little better than just mopping the water on the floor, if you like, if you have an overflowing sink. So how can we make sure that as we invest in particular interventions, we don't lose sight of the bigger picture? Another powerful example is this one from North Carolina that really illustrates the value of prevention. So what this tribe did of Cherokee Indians was to essentially use the profits from a casino that lots of people were against, as you can imagine, but they did a good thing. They actually used the profits from the casino to redistribute money across the local community. And what happened next was amazing. Essentially, just an ejection of about $6,000 a year had a huge impact, positive impact on the community. So essentially, domestic violence went down, so did homelessness, so did domestic violence. The outcomes, education outcomes of young children improved significantly. So what that tells us really is that services policies are often narrowly focused when in fact a more integrated approach may serve these populations better. So I really want you to hold on to that message, I guess. And something we've also learned is that we need to change how we talk about homelessness in the sector, because we tend to focus on stories of rough sleeping and fail to tell stories that confirm the link between individual homelessness and wider structural policy causes. So just to conclude, ending homelessness for good was never going to be easy, and the challenges, especially post-COVID-19, are gigantic. But with humility, determination, and better methods systematically applied, we can begin to redesign the system. So I suppose what I've argued is that response on the three fronts of data, evidence, and better capacity building will help ensure the best use of possible limited resources, and in places create opportunities to save money. Thank you very much.
Thank you so much for that, Dr. Teixeira. And much of what you touched on has been the experience in Australia, particularly during the COVID-19 pandemic. So I'm just going to spend a little bit of time just getting you to expand a bit on some of those issues. One of the key things, I think, during 2020 is the emergency response that has been put in place, and the placement of a large number of people experiencing homelessness into hotels and motel accommodation, and a focus on short-term need to, like, food, making sure that people have access to food and so on. And there's been a huge, I guess, community awareness and activity around those kinds of responses. At the same time, the provision of higher quality hotel accommodation has actually given outcomes that we all knew would be there. If you're given, you know, a good place, a high quality hotel room with access to your own bathroom and so on, you are going to improve, and that was certainly shown. How do we move the community and the politicians and the broader kind of, I guess, a system to really understand that emergency approach, even during a pandemic, is not necessarily the best approach that for ending homelessness?
Well, that's a very good question. We always like to think that the positive energy that we have in the sector and the passion is a good thing. We just need to make sure that we're always giving as much as we can people the tools they can use to make better decisions, if you like. So precisely the use of hotels during the pandemic, they're a good point a good example. We do think it was a good thing that happened, but we always knew as well that hotels are incredibly expensive. So this is one of the reasons why we created the housing cost calculator. It encourages you to focus on who the people are that you've placed in hotels. Do they really have high support needs? Do they just need more money? Is their problem a legal issue? And starting from that place of the person, what might be the next steps for them? So we tried as much as possible to encourage people to start planning then, rather than wait and observe from a distance. So I think that's what I would encourage everyone to do. Is we have a lot of great knowledge to draw on. How can we help people who will be under a lot of stress to analyze their data locally as quickly as possible and come up with better alternatives?
That's great. Thank you. I mean, yes, that's good. I think you emphasized a lot in your presentation around the need to focus effort and make sure that the effort is really prioritized. And you also touched on the example in Utah around the effort being placed in around housing first. And there has been a lot of conversation and resources provided around a housing first approach as a result of pandemic, which is really great to see on one hand, but there is a big focus on people sleeping rough, for example. How do we make sure that when we have limited attention of politicians and so on, and the need to make sure the effort is reaching them, providing the best outcomes, how do we make that effort not focus on solely on one thing and across the broad spectrum of things that you raised in your presentation?
Well, that's certainly in the UK still a journey as well. Less so in Scotland and Wales, but certainly in England, where ministers tend to definitely think a lot more about street homelessness. How do we do it? By telling stories, by pointing to the evidence again and again. And if it's not sinking, we need to keep trying and using different strategies. So we need to be evidence-led in the way we put forward our case as well, I guess. But I think simple stories like the one I told from Utah, that there was nothing wrong with that injection in Housing First, in particular because they were quite targeted in how they did it, and we're not always seeing that. The Housing First is an intervention that should be targeted at long-term rough sleeping. So not just people who happen to be homeless or happen to have, I don't know, alcohol problems or drug issues. It's for very long-term rough sleepers. It's a very expensive intervention. So for a variety of reasons, we want to make sure that it's very well targeted so that resources can then be used for other types of intervention. And most people, all they need is perfectly normal housing and some support to get a job, some support to have enough money to get by, and they will self-exit. So you don't want to institutionalize people. You want to, as much as possible, make sure that they have enough to live on, so they can thrive and they can contribute to their communities.
This question might be a little bit left field, but it's just about preparedness and responding to a system. So during 2020 with the pandemic, the sector had to respond really quickly to provide accommodation for people so that they could keep healthy and well. Very aware that that housing is the long-term solution, and that should be what the focus is on. But the private rental market and the social housing system weren't ready, and so there is now blockages in the private rental market in particular. So, for example, where I'm from, which is in New South Wales, in regional areas, people have moved out to those regional areas, and rents have actually increased, and there's been a huge pressure on trying to find long-term housing for people. How do we use this moment to try and expand that conversation and have a conversation about poverty and affordable housing?
That's a very good question. I feel that one of the missed opportunities until now, certainly in UK, has been to strike similar deals with landlords that we managed to strike with hotels. So I think we need to give enough energy, I guess, and as much attention to doing that type of work in local areas as we did when it comes to striking deals with hotel chains. So that's something we can do, but we can continue to make the case for greater protection. So certainly in the UK, in England in particular, the protections that tenants have are not as strong as they could be. So security of tenure is incredibly important. So we've seen an interesting drop in both evictions as well as the ending of ASDs in different parts of the UK. So that's good. So we've seen the cases of relationship breakdown rise. But what you would expect from the ending of tenancies stabilize for the time being. But that is likely to change next year unless we continue to really pay close attention to increased protections in that space.
And my final question is just around your comments that the sector and service delivery needs to be evaluating itself and being really robust and looking at outcomes and making sure that they're focusing their effort as well. And during the pandemic, my organisation, for example, was very conscious of the need to evaluate and record the activity and the action that was being taken to make sure that we had, documentation of it and we could understand learnings from it. The sector, however, is very under-resourced in general. How would you suggest services actually take on that robust role when government's not going to, and when the service system itself is not playing that role? What suggestions do you have?
A number of things, I guess. In terms of monitoring what's happening, again, putting in place simple tools that will help services capture minimal data as quickly as possible feels quite important. So making sure that we are looking out for the organizations doing vital work and seeing what we can do to help is always important. That's when it comes to data collection. But when it comes to impact, it shouldn't be the role of single organizations, and certainly not the role of the organizations doing the work to evaluate their impact. This is why in the UK there's been a trend towards creating these work centres that can take a more strategic perspective and essentially invest in very rigorous evaluations, but across multiple locations, across multiple services, because it saves money. It helps address research wastage, and it really helps you take a much better view of what impact looks like. So it shouldn't be for single organizations to do, but certainly you do need someone to be able to do it. And usually government does have a role to play in injecting in this, investment in this type of work for sure.
Great. Thank you so much, Dr. Teixeira. We really appreciate the presentation, and it touched on many things that we're discussing at the moment in Australia and will be touched on during the conference. I think the messages you had around the systemic change and the need for affordable housing, but also the need to address poverty is really important, particularly at the moment when we're looking to see job seeker being reduced at the end of the year, when, again, all the evidence has shown that increasing income support for people really makes a huge difference to not only homelessness, but a whole range of wellbeing measures for people. So thank you so much for your presentation. We really appreciate it, and look forward to the discussions that are now going to be had across the 2 days of the conference that you have very much touched upon. Thank you very much.
Thank you, Katherine, and wishing you all a fantastic conference.